Idaho state officials have submitted a Medicaid expansion waiver, which, if passed, would require patients to get a referral from a primary care doctor before visiting a specialist for family planning services. 6 on your side's McKenna King joins us live in studio with the background on the waiver, as well as concerns from State House leaders and residents.
So, Don, what that means is if this waiver does pass, those insured by Medicaid will no longer be able to simply go to a gynecologist for their birth control pills, pregnancy care, and abortions. The waiver would require you to see your family care doctor first for all of that.
If a person wants to get contraception to avoid unwanted pregnancies, I have no idea why we would want to make it as difficult as possible for them to do so.
A topic Representative Alana Rebel has been passionate about since the legislative session, when other state leaders pitched the idea for the family planning waiver following the passing of Medicaid expansion.
It sends women to worse care, makes it more difficult for them to access contraception.
The waiver would require women to visit a primary care doctor for family planning services, and if that woman wanted to visit a specialist using Medicaid, she'd have to visit the family care doctor first for a referral.
And to have to get permission from a primary care physician to see a specialist can cause needless delays.
Lori isn't on Medicaid, but something she's learned in the last few years is those delays can sometimes mean the matter of life and death.
I was bleeding a lot, and I had seen my primary care physician about it, and he had prescribed me with iron tablets.
Nearly requiring blood transfusions, Lori visited her OBGYN, only to find the cause of that bleeding was uterine cancer.
If my care would have been delayed, I could be dead right now.
According to the waiver, the goal for these changes is to improve healthcare access, care coordination, and overall health outcomes. But Lori and Representative Rebel believe it would do anything but improve overall health. And they aren't the only ones against this waiver. According to the Department of Health and Welfare, out of the total number of comments from Idahoans on the waiver, 383 people were against the waiver and 7 people were in favor of it. Of those in favor of it, Representative Megan Blanksma, who spoke out in favor of the waiver during the last legislative session. She believes the reasoning behind the waiver has been misconstrued.
The whole idea of the family planning waiver is so that the doctor coordinates all that patient care.
Her argument is that the family doctor is looking at the entire health of the patient versus a specialist who may just look at one health aspect.
So really, it should streamline the process for the patient, and we're hopeful that we can find some cost savings for Idaho taxpayers that are footing the bill.
Then, if a patient needs further treatment by a specialist, Blanksma says they should be able to easily obtain a referral to an OBGYN from that family doctor. And the Department of Health and Welfare should know in the next few weeks whether the application is approved. Then they'll open a federal comment period for anyone to comment.
So has something like this passed in other states?
So Representative Rebel says it has been pitched in multiple other states, but it hasn't passed in any of them.
All right, thanks, McKenna.